Being active has been so central in my life. It brings me a tremendous amount of joy. And by being active, I'm able to do the things that I love to do. I've had back pain my entire adult life. Since I was 17 years old. I had a severe car accident when I was 17, and throughout my late teens and early 20s, I always thought everything in that back pain was related to that accident. And it led me to the point where I was taking incredible amounts of over-the-counter drugs to try to control it, and had to reduce my activities from an extremely active person to a very non-active person. At the age of 32, I was diagnosed by a rheumatologist at the Rocky View Hospital with an autoimmune condition, ankylosing spondylitis. I spent the better part of 2005 in a wheelchair after I was diagnosed with AS. The inflammation had got to a point where I could no longer function, ambulating on my feet, and it took everything from me. It took my career.
Back pain is a very common medical problem. Most of Canadian men and people in general will experience back pain at some point in their life. So inflammatory back pain is the symptom of inflammatory arthritis, which is an autoimmune form of arthritis affecting spine and peripheral joints. Treatment of inflammatory arthritis early on can prevent permanent damage and development of disabilities. We cannot say that we can cure the disease. However, we can treat it very effectively, and especially in the last 7-8 years, there have been revolutionized therapies for treatment of inflammatory arthritis, including ankylosing spondylitis, that can change progression of the disease and can change quality of life and symptoms. Traditional first-line treatments include anti-inflammatory medications. In the last 7-8 years, we have new class of medications called biologic agents that are proven to be very effective in controlling not only symptoms of the disease and quality of life as a result, but also shown to be slowing down structural progression of the damage.
As a result of a lot of the medications I took prior to having a biologic, Remicade, the side effects led to some kidney disease that I have now. The kidney disease is severe. I'm a dialysis patient awaiting a kidney transplant now. The treatment that has really worked for me for AS has been a biologic treatment. I get an infusion every 6 weeks. When I started to get into the right medications for treatment, I was able to return back to activities. 2010, 5 years after my diagnosis, and 2 years after I started my biologic, I was able to climb the tallest freestanding mountain in the world in Mount Kilimanjaro. It has brought so much to my life. It's allowed me to return to an active lifestyle. It has allowed me to travel across the world, do the things I love to do through the advent and use of this single drug.